Orthopedics, the hip part 2. Total hip replacement SROM implant. Total hip replacement threaded cup SROM implant. Well positioned non-cemented systems. There's a typical implant. There's a second total hip replacement of a 52-year-old at CDH. Only lasts for two years, unfortunately. It loosened up. Total hip replacement CDH. See, deformed head, false acetabulum, secondary OA. Total hip replacement wound closure. Here's a review of all the different types of hip replacements and their actually a review of total knee replacements and their development. There's a total hip replacement using a gripper cup and isoelastic stem. There's a loose cemented system for the large areas of lucency. There's a total hip replacement OA in a 51-year-old total non-cemented system. There's a non-cemented system. Look at the bony ingrowth onto the surface. That was at 2 years. There's a total hip replacement. The shaft is perforated. Had to be immediately revised. Posterolateral approach to hip replacement, the incision. Pre-OA of the hip. Ankylosis for hip replacement. This is patient with ankylosing spondylitis, young. On this side it fused by itself, on this side OA. Reaming the acetabulum during a hip replacement. Total hip replacement, dysplastic hip. A girdleston just means all of the implant has been taken out, usually because of infection, and then you have to put a new system in. There's a threaded cup with bony ingrowth at 2 years. These threads, usually with titanium element, encourage bony ingrowth. Loose cemented systems will have to be revised. Here it is, it's been revised. Look at the mesh that's been used to hold in the bone graft. There's a total hip replacement Charlie system. Very good hip from the 60s. Still doing quite well, though it depends upon cement. Some surgeons still use it. Here's the implant being placed. This is a conversion of an arthrodesis to a total hip replacement. Difficult technical operation, but good results. There's a cup that's been removed with the cement mantle still on it. There's a modern cup with mesh on it and also allowing for screw fixation. Just to review of difficult types of hip replacement: fracture around the hip using bone graft, and various tumour cases. Dealing with the degree of bone loss, quite a problem. There's a thrust plate total hip replacement that fractured around it. Needs to be revised. Fractures around implants, difficult surgery. There's a arthrodesed hip converted to a total hip replacement. So there's arthrodesed over this pin and plate, and there's a surgical procedure. This is actually a hip fusion, putting the K-nail across. There's a hip replacement underway, the implant being placed. There's a lot of discussions of these at various meetings, all the techniques required, different types of implants, bone grafting techniques. Isoelastic hip replacement here, look for a CDH as bilateral. A loose hip replacement converted needs to be revised, technically a difficult operation. Look at the lucency between the cement and bone interface. Loose hip replacement, large head, these cause erosive synovitis, unipolar. A loose Charlie hip replacement, it's loose at cement bone interface. Muller was another type of hip replacement, same time as Charlie, a larger head. Looseness at the cement bone interface. A loose total hip replacement Muller type, again, here it is, perforated the shaft. This is the McKee-Farrow, metal on metal. This back from the 60s, they were good. They fell out of favour for no good scientific reason. Now they're back being used, metal on metal articulation. So-called McMurray osteotomy, transverse, held with a plate for OA. Very old operation from the 30s and 40s. He's using MIS technique, special holder for preparing the femoral shaft. There's an Oxford type total hip replacement. There's about over 600 different types of hip replacements. Most of them are good. A few of them fail at the early stage. Perforated total hip replacement is perforated. Fracture around it. Look at this fracture here. Here it is, a more dramatic presentation. Here's a total hip replacement post osteotomy of the acetabulum. Didn't work, still developed OA. And here is preparing the shaft, a total hip replacement in a 50-odd-year-old patient. A looseness around the isoelastic implant. It's a takedown. Arthrodesis being converted to a hip replacement. See? Takedown fusion. It's fused here. You have to put a hip replacement. You have to identify all the bony landmarks and then work out exactly where to place the implant. Very difficult. And here's the post-op result. Very good post-op result. And here is surgery underway. Tumour cases. MRI is very useful. It's the tumour subtrochanteric region of the hip. There's a lot of bony loss there and you have to deal with that. Imaging planning. There's the tumour mass being excised in the pot, and after it's been excised, a total hip replacement has been put in there, and then you have to put some bone graft to deal with the area of bone loss. It's actually a renal metastasis, and here's preparing the acetabulum. Here's subtrochanteric fracture from a tumour metastasis from the kidney here. It had been internally fixed initially. I hope you enjoyed those cases. Hip replacement surgery is very successful, but there can always be associated problems, and they can produce or present huge technical challenges. Most of these are related to bone stock loss or deficiency, and we hope that new techniques such as endocultivation will deal with these. Thank you.